6 questions to think about when choosing a chiropractor for yourself. Hi, I'm Chiropractor Will Kalla, and I've been practicing chiropractic care since 1997 when I graduated. So I've been doing this for 27 years. I've been in Singapore since 2006. And I have a lot of clients asking me who's the right chiropractor for them. And different conditions, you might want to choose a different chiropractor to resolve your issues. So anyway, I'm going to give you 6 questions that I'm going to read through, and then I'm going to elaborate on them to help you decide which is the right chiropractor for you to choose. 1. What is the chiropractic's experience in handling problems that you're experiencing? 2. How does the chiropractor intend to treat you? 3. What makes this chiropractor's treatment different from others? This is especially important if you have visited other chiropractors and the treatment has failed to resolve your issues. 4. How does the chiropractor intend to monitor progress? 5. What is the estimated time to resolve a case like yours? 6. How does the chiropractor's track record look like resolving cases like you have? All right, these are 6 important questions you should ask the chiropractor so you get a better understanding if they're the right person to resolve your issue and help you. So let's hop on to number 1 here. What is the chiropractor's experience in handling problems that you're experiencing? Let me give you 2 examples. I did corporate healthcare back in Sweden around 2000, and I had a client who had a hip problem, an older gentleman that worked in this company that I went to treat the staff there for once a week. And he needed to go for hip replacement surgery, and he consulted a very senior orthopedic surgeon who had done surgery for probably 30 years, and very renowned surgeon, and he was going to do his hip replacement surgery. So he came back to work after a couple of months after doing the hip replacement surgery, and I saw him limping severely. And I asked him what happened. He said he had done the surgery, but they have cocked it up. Basically, he had screwed up the hip replacement surgery by 3 centimeters. So his leg was 3 centimeters shorter than the healthy leg. And I asked him what happened. Apparently, the senior orthopedic surgeon, very renowned and very experienced, this was his first hip replacement surgery. So he had never done a single hip replacement surgery before this case. And there was no way of knowing that without directly asking the doctor if he had done this. He just knew that he's done surgeries for dead cage, but he never knew that he'd never done this type of surgery. So when you meet a chiropractor or a doctor or anybody, therapist for that matter, you should know how many cases like you have, how many similar cases they have helped before. Okay, we know for scoliosis surgery and all that, it takes them about 50 screw placements to know that they're professional doing this scoliosis surgery. So there's a learning curve in different treatments and surgeries and therapies and all that. So make sure that you don't get a novice one for that. Second example is my sister. She had this hallux valgus surgery to be done on both feet. So basically means that her big toe is crooked bent inwards. She did the first surgery, and there was in the team there that helped her, and she went well, no problems, no hiccups. And the next time she was supposed to do the other foot, one of the female surgeons there, a young one, was supposed to do the second foot for her. And she had the surgery done, but it was a mistake. It was a cock up there again. They screwed it up. There was some bones were misaligned after the surgery was done. And it turns out that this was her first solo surgery. She had always done this with the support of others, and she had never done it single-handedly. So make sure that whenever you get a therapist or something like that, really find out what is their experience of handling cases like you're suffering from. All right? Clearly my sister had to do a resurgery for the second foot, but it's fixed now. Second question, how does the chiropractor intend to treat you? There are many different modalities that the chiropractors can use to treat people. Most famous one, the chiropractors are famous for, is spinal manipulation, spinal adjustments. So if you have a neck torticollis, wake up this for a low back and all that, that's great. Go for a manipulation. You can do miraculous results, resolve it maybe in 1, 2, 3 sessions. That's what chiropractic got famous for, helping people over decades. There are, of course, other alternatives. You can use ultrasound, laser therapy, electrostimulation, shockwave therapy, rehab exercise. There's a multitude of things that can be done. Excuse me. But if a chiropractor for you says that, okay, I'm just going to manipulate you for the next 50 sessions. You're going to come in for a 3-minute session. You'll have a diminishing return after 5, 6, 7 sessions of these manipulations. Maybe they're not up to the task to solve your problems, these manipulations alone. Maybe you need to do some other things for that. I had friends growing up that went up to play for NHL ice hockey there. They have a team chiropractor and they get adjusted pretty much every single day. But also they get tackled 50 to 100 times a week. I haven't been tackled for over 20 years myself. I don't know people that get tackled around here in Singapore for problems. So if you're not in a full contact sport or getting tackled like in ice hockey, you probably don't just need adjustments alone multiple times per week. Initially starting a therapy, getting adjustments more frequently done, fair enough, all right? But in most cases, you don't need to sign up for package 50 to 100 sessions to be adjusted. That's not going to change your spine. It's not going to move your spine. There's too many neurological safeguards in the spine to prevent that from happening, all right? Otherwise, all the Greco-Roman Olympic wrestlers, they will look like Quasimodo, okay? That just doesn't happen that way. The spine doesn't move just by manipulating it alone. You can do that if you have this torticollis muscle spasm and all that. You can resolve it and it moves back. But that's about it. Number 3. Sorry. What makes this chiropractic treatment different from others? Some of the people that contact me have seen few other chiropractors before. And what they should be asking, what they should be focusing on, how is this chiropractor different from the previous chiropractor they have done? If you're going to chiropractor and adjusted you 50 times for a year or 2 or 3, whatever, the frequency and how often they do, and you go to the next person and he ends to do the same thing and the first thing didn't resolve you, I don't think there's that big of a difference in skills between different chiropractors in adjusting that it will actually make any difference for you. So if you're looking to go for another chiropractor for a back problem or something like that, and they only intend to do adjusting, like the previous one had done, probably not the right approach and not the right solution for you. So try to look for something different. Maybe you need more of a multitude of combined treatment with a few different modalities to be done, maybe rehab incorporated into that. But yes, if the next person is in to do the same thing as the previous person did, probably not the thing that's going to resolve your problem. Number 4. How does the chiropractor intend to monitor your progress? Okay, there is subjective ways to monitor progress and there's objective ways to monitor progress. So think of it that if you have a child or yourself and you're having fever and you go to see the doctor and you get your antibiotics for the fever, but your fever doesn't go down. So measuring your fever is an objective measurement. It's not how you feel and all that. It's an objective measurement and it can be reproduced over and over and over again. But if your objective symptoms, fever in this case, doesn't change, probably you have the wrong antibiotics and you may need to change to a different antibiotics to resolve that bacterial infection that you're suffering from. So we can do the same thing in chiropractic care. There is different ways of doing objective measurements. You can measure the muscle grip strength in your hand, whatever you're measuring, muscle endurance, movement, range of motion, there's different. And then you can have subjective, those are called questionnaires. Very often the questionnaires are developed by orthopedic care or even physical therapy, and they're used for all kind of low back problems or neck problems or headaches. And they are used with such a big group that we can say that if this much change is changed in the answers that you give, that objectively you will have some improvement, all right? But if you can have subjective. But if you can have objective measurements like muscle strength or something like that, you can measure it directly, then it's far better, way better doing that. Personally, what I use x-rays to measure. I can clearly see if there's a structural change between the x-rays. And I prefer that way because that gives me very objective measurement if there has been improvement or not. 5, what is the estimated time to resolve a case like yours? So when you go to see a chiropractor, and if you're very familiar with the problem, he should be able to give you an estimated timeline, how long it takes to resolve a problem yours. All right? Will it take weeks, months, or years? And like we were talking about these adjustments alone, they will give you diminishing returns. I have unfortunately seen clients that have been to other chiropractors, being adjustment only or manipulation, maybe once a week, a couple times a week, and they've been doing that for up to 3 years. In some cases, they say that they're going to fix their neck structure, but they didn't even bother to do a second x-ray to verify that that's happening. Okay, so it's very important to get an estimated idea what they have done before for cases like this and what they expect to be the timeline for resolving your problem. 6, how does the chiropractor's track record look like resolving cases like you have? This is very important. Do they have a solid track record of regularly solving cases like yours? Can they show the objective results? What is the estimated timeline of this? So personally, I look to do x-rays on my patient because I can literally change the structure on my patients, okay? And I have done this method now for over 10 years, so I can give you a very reliable, say that majority of people will improve this and this much in this time frame, okay? Vast majority will be done in about 3 months, okay? And there's a small minority that take longer than that, and there's a very extremely few cases that I can't resolve at all, okay? Those could be severe car accidents and other things. There's nobody that's gonna be 100% of the time to be able to resolve everybody. But what you wanna be knowing from the chiropractors, how long is it gonna take? What is their track record? Can they show you previous cases, what they actually have done to them, how they resolved them, how long did it take, what did they do? It's very important to find that and know that from them. If they're just gonna be talking, and not showing you any concrete evidence or showing that, hey, this is what I'm doing for clients, these are the outcomes that we had, and show that this, like for me, I choose to use x-rays to show before and after, or even have hand grip measurements. If they can't do that for patients, then you should be worrying and maybe perhaps seeking a second person, because you want to know solid track record and see how they can perform and how they can help you. So I hope these 6 questions will help you to decide the right therapist or chiropractor or doctor for yourself to help you resolve the problems that you're having. Thanks for listening. Take care. Bye-bye.